Hi, my name's Jacqueline Jaspers, and I'm going to talk to you this evening about nursing informatics competencies integrated into nursing curriculum. But before we get started, I'd like to provide you with a brief overview of objectives. First, I'd like to speak a little bit about nursing education and its process, and how nursing informatics competencies are integrated into the curriculum. Secondly, I'd like to take you through the CUSIN competencies. CUSIN stands for Quality, Safety, Education, and Nursing. And there is a specific set of competencies related to nursing informatics. Third, I'm going to talk to you a little bit about implications for future in undergraduate nursing curriculum, as well as some post-grad information. Also, I would like to discuss rationales and implications for the future to make sure that we're providing safe, ethical, and efficient care through the use of nursing informatics. Informatics has been included within the nursing curriculum ever since the Tiger Initiative was integrated. Tiger stands for Technology Informatics Guiding Education Reform, and it was designed to address a set of skills that are needed by nurses who will be providing care in the 21st century. The skill set includes informatics competencies that range from just basic computer skills to more advanced level information technology and literacy competencies and expertise. Despite the significance of the Tiger Initiative, very few nurse educators have embraced and operationalized Tiger to transform nursing practice and education to better prepare nurses to practice in a technology-rich healthcare environment. The Tiger Initiative, as well as different competencies which nurse educators need to help themselves to be more proficient in the provision of technology and resources for their students related to technology, needs to be integrated into our curriculum. That's the only way that we're going to be able to prepare our nurses for the high-touch, high-tech technology patient-centered care within the 21st century. There is a gap between what most educators need to know and what they currently know about informatics and the competencies that their students should be embracing within nursing care. This is really the first step towards the improvement of the integration and actual use of technology within nursing schools themselves. When we look at the CUSIN competencies, this is really a project that was developed to meet the challenge of preparing future nurses who will have the KSAs, or the knowledge, skills, and attitudes necessary to continuously improve quality and safety of the healthcare system, in which they work. CUSIN was derived from the IOM's initial report, and it's a national advisory board which also brought forth information to define what competencies should be utilized for quality and safe care. Within each competency, there's a definition and also a set of KSAs that undergraduate nursing students should be able to perform prior to their graduation. In addition, there are also KSAs for postgraduate nurses as well. Within each competency, as I stated earlier, there is a definition, and the definition of the informatics competencies are the use of information and technology to communicate, manage knowledge, mitigate error, and support decision making. There are specific things that we need our nursing students to be able to do prior to their graduation. CUSIN gives us a great framework to be able to assess those program outcomes. You know, we want our students to have that basic knowledge of informatics. And within that, it talks about not only just general knowledge related to informatics competencies, but also be able to identify essential information that must be available as a common database to support patient care. Also describe examples of how technology and informatics management are related to quality and safety in patient care. Within the skills portion, it sets forth different informatics competencies related to the use of basic computer skills as well as electronic health records to be able to respond appropriately to clinical decision-making supports, understand how information is stored and the usage. And then the other thing that it really discusses are the attitudes needed to provide appropriate, necessary care and ethical care for our patient base. In the post-licensure programs, the KSAs are very, very similar. However, there's very little research available as to the actual integration of these into doctorate programs. There is specific content that is needed to provide essential and safe care for our patients, and the CUSIN competencies for postgraduate nurses will help to provide that for doctorate programs as well as master's programs, looking to make sure that their students are appropriately trained. As far as future indications go, we need to be able to assess our basic computer skills. And what some researchers are suggesting is that there's an assessment done prior to nursing students' admission into different programs. What we're finding is that there are self-assessments out there that are being utilized, and without a specific self-assessment tool, students are assessing their competency of nursing use of technology much higher than what their actual competency level is. For the future, we need to make sure that we are including fundamental concepts and intellectual capabilities and understanding what each of these are and how we can assimilate actually or get our students more involved with the use of informatics within and throughout their whole nursing education process. There needs to be individual competency assessment prior to graduation, and then with that, we will be able to prioritize that educational need of each student. This research is very applicable and relevant for leaders in nursing education institutions who are ready to ensure that students leaving the nursing program have a grasp on nursing informatics competencies in order to provide safe, effective, and ethical care. So looking to the future, just as Fleetwood Mac sings so prolifically in their song, Don't Stop Thinking About the Future. That's really what we need to do with our nursing students. We really need to look into additional research opportunities to objectively measure the competencies at all levels in the nursing curriculum. And then also, in order to support that, we need to make sure that our faculty are adequately prepared in order to meet the needs of the students that we are educating. Thank you.